Okay, well, welcome everybody to our February 2024 St. Paul Speaker Series podcast. So we normally do this at the end of every month, the last Friday of every month. And the purpose of this podcast is to bring knowledge to alumni of St. Paul Secondary School, which is in Kabwe. So we bring experts in all sorts of fields. The men of the alumni group are interested in healthcare, economics, politics, laws, policy, business. So we discussed a lot of things, but the whole point is basically to uplift the lives of men who went to St. Paul Secondary School with impacting different types of knowledge that we can use to better our families, our careers, and so forth. And then also to develop the country, because at the end of the day, if we all have a shared vision, then Zambia is going to develop. So that's why we do these things. So we're very privileged that you're willing to come here today and speak to our group. We record these meetings because some people are traveling or they're working, that being 15 hours in Zambia at this point. But they want to see what's going on, and then they'll get the details later, and they'll reach out to you as well. So our speakers today are Mrs. Salati. Mrs. Salati is a physiotherapy specialist and acting president of Physiotherapists in Sports in Zambia at this point. She's also a member of the Zambian Society of Physiotherapy, where she serves on the logistics and technical subcommittees. Our other speaker is Ms. Lweendo Mapani, who's a lecturer in massage at Lusaka's Apex Medical University. And we're also joined by two other presenters today, Mrs. Mwanza, also a lecturer at the Apex Medical University, and Mr. Hydan Chilufya, who's a lecturer at Evelyn College in the physiotherapy department. So today's topic, it came up as a result of people getting very interested in resolutions for the year. Like, everybody wants to get healthy, and there's different ways to be healthy. And massage is one of those that probably most people do not know about just by thinking about healthcare. We all think about, pills and that kind of thing. But I think it's a very vital part of the healthcare system. So we shall let you take over and give us, your inputs about physiotherapy and therapeutic massage. My name is Musonda Kapatamoyo. I went to St. Paul's and left that school in 1989. So on here, other gentlemen that went there at different times, and you're going to see in the chat, we give our name, and there's going to be a word that follows the name. It's called Penta. Penta means 5. So if I say Musonda Kapatamoyo Penta 89, that means that's when I left St. Paul's. And that's how we get to network and know which cohort you're in, and yeah, just find each other. So please, Mr. Salati, take it away.
Okay. Good afternoon, ladies and gentlemen. Mr. Kapatamoyo, Dr. Kapatamoyo, isn't it? Musonda Kapatamoyo. Thank you very much for giving us this opportunity as physiotherapists who are specialists in massage to come and speak about massage. And as you said, I have colleagues with me, 2 colleagues from the Lusaka Apex Medical University who are lecturing degree physiotherapists. And then we have Mr. Chilufya Hydan, who's also lecturing students who are getting diploma in physiotherapy. I have taught massage for many, many years until I retired last year at Lusaka Apex Medical University and the University of Zambia. I think with that, I would like to call upon Vuniwe to start the ball rolling, because I would like that she speaks about what massage is and the benefits of massage before we get to regulation and who operates and who does what. Vuniwe, I think you can take it up. You and Lweendo.
Good afternoon.
Good afternoon.
Good afternoon. Vuniwe Mwanza. Sorry about the feedback. So my name is Vuniwe Mwanza. I'm a lecturer at Lusaka Apex Medical University. So I'm going to talk about massage. So massage is basically physical manipulation that we're able to manipulate the tissues that the body has. So we're able to work on the skin, the muscles, the tendons, and also the ligaments. So with massage, we are basically, depending on what is the condition, do you want to have massage that is stimulating or do you want to have massage that is relaxing? So with that, we have the different types of massage techniques and manipulations that we are able to do. So with the massage manipulation, because massage is simply a systematic way of dealing with the soft tissues of which we have. So we'll be able to do that. So one of the benefits of massage is to relieve stress. So most people come to massage anyone that, as long as you're living, you're working, I think at one point in life, we do get stressed. So, and one of the things that you can get from massage, that when you come for a massage, a full body massage, or just part of having maybe a neck or back massage, or just a foot massage, you're going to get relieved of your stress and thereby be able to feel better for you to work effectively for the next week. So all of us have stress, and massage comes in, works handy very well in terms of relieving stress. As we're growing older, some of us might have aches and pains. So with the mechanical and physiological aspects of massage is that we're able to come and reduce the pain, and the pain is reduced as we are doing either we are working on the techniques of which Ms. Mapani is going to kind of like be able to bring unto us. So if you've got any pains and aches, massage is able to relieve the pain that one has. So apart from the pain itself, massage is able to be used in various conditions that you might have. That is a backache, or even in terms of a stroke, and in other different types in a pregnant woman, but in the second trimester, you can be able to come and look at deal with massage. You can be able to do with massage even people who've got cancer, depending on the stage where one is at. So we are able to use massage in various conditions, and thereby you are bringing up healing and relieving, because the massage that we do is basically therapeutic as compared more on the relaxation part. So those are the few minor benefits that you have, but it's about overall health of one, as you want to be able to work effectively and just to be able to conquer and do much in the workplace. Thank you.
Thank you so much, Ms. Mwanza. I think Mrs. Salati said that Ms. Lweendo is going to be next. You could just introduce yourself and tell us what you do and give us some input.
All right, thank you so much. Okay, I'm Lweendo Mapani. Yes, and as has already been mentioned several times, I lecture at Lusaka Apex Medical University. I also have some other activities that I partake in with regards to sports. Well, can I say physiotherapy in sports, and also private practice and so on. Massage is one of the courses which we offer, and I think I'm really grateful for this opportunity to clear up the air with regards to what we do. So when it comes to massage, there are several different manipulations that we use. Okay, we have a group of massage manipulations that are more or less relaxing. We call those stroking, and deeper manipulations that we call petrissage. And then we have other manipulations that are stimulating to the tissues that we call development. So we use a combination of all these techniques to bring about a particular effect, depending on what it is you want to do for the client. So, but what we normally teach here at Apex, we usually teach, in any degree program really, what we normally focus on is therapeutic massage, which is how to give massage in a way to help somebody recover, right? But what is normally known out there in society is mostly only massage for relaxation, right? But massage has so many different uses. Mrs. Mwanza has mentioned some of them. It goes as far as even helping people with constipation, and helping people with chest problems and all that. So there are different places where people can access massage services safely. Okay, so we know there are spas, right? And we know that there are different types of spas. And we also know that there are physiotherapy practices. So what you go, when you're going to look for a massage in order to recover from a particular, maybe a backache, okay, or an injury, you would typically go and see maybe a physiotherapist, and they can do a thorough assessment. It would not only be massage that they'll do, they'll probably incorporate some other modalities such as electrotherapy and exercise and a bit of massage. However, if you wanted to access massage simply for relaxation purposes, a physiotherapist could assist with that, but normally people go to the spas, right? So now I think what the public needs to know is when we are going to these massage parlors or we're going to see a physiotherapist, what are you going to expect? What can you see? So I'll highlight on what you can expect at a physiotherapy practice. And I think my colleague Hydan will highlight what to expect at a spa. So when you go to a physiotherapy practice, physiotherapists are health professionals. So we are trained on how to help people recover using physical means. So when you go to a physio practice, you're going to get a full assessment. They're going to try and check, do some tests, see what could be wrong. They'll come up with a diagnosis, then they'll come up with a treatment plan, and they'll inform you what the diagnosis and treatment plan is, and they'll let you know what you need to do if you need to, there are any extra things you need to do. And and then we follow the rehab plan, which may or may not include massage. Massage is just one of the things which someone could find. So if they come to a physiotherapy practice, they are not going to come and get, say, maybe a full body massage. You get the massage that is required for that specific area. If it's the neck, where you're having problems or pain for that specific area, right? If it's the back, it's going to be specifically for the back. So you wouldn't really typically walk into a physiotherapy practice and hope to get, say, a full body massage there. It's more like a clinic or a hospital. Yeah. So I think Hydan can elaborate on what to expect when you go to a spa.
Thank you so much, Lweendo. Mr. Chilufya, yeah, go ahead.
Okay, good afternoon.
Afternoon.
So, yes, so I'm Chilufya, a lecturer in Actively Known College, and also specialized in massage. So I do have a stationed parlor for massage and also do mobile services in massage. I think I've been practicing for more than 5 years. So the spa arrangement, it's quite something that is very interesting. We do, as Madam Lweendo has said, do rehabilitate and also relieve quite a lot of pain through other conditions by applying proper therapeutic manipulations or techniques in massage. So for a spa, the way it is, first of all, you are looking at the assessment part. When a client comes in, you'd first of all assess. We have got an assessment form that indicates what the client's options of what the client really wants, what you should specialize in, what you should focus on, I mean. So we get their details, get their consent. Also, it has got some demonstrations in a picture form where they get to select the body parts and the tissues that they really, really want us to focus on. And also there are different types of massage that we give. So the client on the same assessment form will choose, and we explain before they choose. So we get to explain the whole assessment form, from the details intake to choosing of the body part, and also to the issue of them choosing the pressure that they want in terms of different types. So explain to them, this is what we do in this type of massage. So we've got examples that we do. Deep tissue, the Swedish massage is just relaxation massage. We have the shiatsu, reflexology, and also we have aromatherapy massage. So the patient to get, or the client to get to choose from the list of the options that we give through the assessment forms. Then from there, we proceed to a bit of, after the assessment form, we'll go to what is known as patient's exposure process and positioning. So we'll do the exposure, position them nicely in a comfortable way. That is after we have made sure our room is comfortable for them and safe. So it depends on the client's preferences in terms of the temperature of the room, the exposure, the lighting, everything should be according to what they prefer. So we'll do that after we'll expose after we have oriented them through the rooms that we have. So we expose them, then we position them. Then from there, we'll start a bit of palpation, touch around the tissues. If the patient has come through for back massage, we'll do a bit of palpation, tissue palpation, bony palpation, just to prove what they were indicating, that this is where they need the pressure to be done from. So we'll do that nicely, palpate the area, for any pain, for any muscle spasms, for any tension in the muscle, and also just check for body alignment, because patients, when they're really tensed up, or clients, when they're really tensed up, you can able to see from how they're sleeping. So we get to go through that process. Then we start the massage. And when we start, we focus on the power of touch. So we basically make sure there are no disturbances around. So we start with our manipulation very well, from indicated points of less pressure to indicated points of high pressure, so that it's nicely done for them to relax very well. So the sessions, it will depend with what the client wants, on how the situation is. If they're so much tensed up, we would maybe massage them for a minimum of 30 minutes, even an hour, or 1 hour, 30 minutes. But there's what we call massage hangover. So we don't exceed some located time. So we also look at also the bulkiness of the tissue. If the patient or the client has got less tissues, we also reduce on the time or duration for the session. If the client or the patient have got a lot of tissues, we increase on the duration and also the pressure. So after that process is done, when concluding, we'll make sure we'll also add in body warmings, because either at the start or the end of the session, we'll do what is known as body warming. So these promote muscle relaxation. We'll warm a towel, steam it up nicely, and apply it on their tissues, so that blood circulation is improved on the area that we are about to, or after we have massaged. And from there, if they want something, they have liked the massage, some clients request for extra work on their face, and we call that as facials. So in massage, we learn about facial massage, we learn about different types of manipulation that can be performed on the face. So incorporate that with the extractions of maybe if they have pimples, or also exfoliating, to just make sure the skin is intact and on point and it can grow, because that's the only way they're able to see positive results. So we do the steaming of the face, we do the massage of the face, we do the warming of the face, extraction of the face. Then from there, we close the session. So when closing, we have a rating form. So we give a client a rating form. They rate us from 10, and it has got points, whether they're satisfied with the massage and what we need to improve and work on. So that is how it is done in the spa. And from time to time, we get to have research about different massage techniques and also different conditions that are presented to us through different clients, so that we can give the best that we can. And also we have every week we have meetings to practice through the techniques that we're supposed to give out. I think that's what happens in a spa, just in a nutshell.
Thank you so much for that thorough explanation, Mr. Chilufya. Mrs. Salati, please take it away. You are muted.
Afternoon. Thank you for those presentations. And with what has been presented, I just want to make something clear. When professionals as physiotherapists were doing massage, one thing why it is good to go to a physiotherapist, a qualified person, or anybody who does massage should be able to know their anatomy and physiology. If you don't understand your anatomy and physiology, you're really just touching and playing with someone. Why am I saying this? When you know your anatomy and physiology, you know which direction. We have a direction when we massage. And we go to certain areas because we are draining to those lymph nodes to get rid of anything, any excess or any impurities, I'll call them in inverted commas, out of the body. So as physiotherapists, we know which directions to massage to. For example, if you're massaging a leg, you must massage from the toes to either posterior aspect of, not posterior, sorry, behind the knee or into the groin. You can't, we have seen people massaging from the hip to the toes, but now what are they draining to? Those impurities that they have, where are they going? And these things you can even see on TV. So when you deal with a physiotherapist who's qualified to do massage, they are going towards the right direction and they are draining the impurities so that after they have finished massaging you, you even feel better because they get rid of the impurities in your body. The other thing is when we are massaging a patient, we only expose the areas that we are massaging. We don't expose the whole body when we are massaging the leg. And even if you're doing a full body massage as a physiotherapist, you don't remove the underwear and you don't remove the pants, you don't remove the bra. So you remove the rest of the things, but you just expose the areas that you are treating. If you're doing the face, you can't expose the whole body. You just expose the face and the person will be nicely covered, and we make sure they are comfortable, meaning they are warm if it is cool, but you will only expose the face. Before you even start to massage as a qualified physiotherapist, we do get permission and explain. When we have explained to the patient that this is part of the treatment, we are going to tell them that I'm going to touch your body. Is it okay with you for me to touch your body? And if they say yes, you do the massage. If they say they are not comfortable, there have been people, especially in my experience as a physiotherapist for many years, that would say, no, actually, I don't want that. Explain the benefits of the massage that you're going to do. If they still say no, you respect what they want. So we don't just directly go and start touching them and doing whatever has to be done. You have to explain and let them allow you to touch their body. So operation, I think what Mr. Chilufya has said, basically that's what happens in a spa. A person will walk into the spa, make an appointment, or just walk into a spa and say that I would like to have a massage. They can decide. I want a massage of my upper back. I want a massage of the whole body. They can decide because they've got no, they are not ill, or they don't have a condition, in short. So they can go walk in and have a massage. What happens in a massage? We don't know. In a massage parlor, we don't know, excuse me, except for what Mr. Chilufya has explained. Anything can happen in a massage parlor. There are times when people go to a massage parlor and more than massage is happening in the massage parlors. But when we, as lecturers, are talking to students, if you are dealing with physiotherapy students, we tell them that going away from what they have been taught or touching any parts of the body that they are not supposed to is illegal, and they can be blacklisted by Health Professions Council of Zambia. So they walk in and they can get a massage, and whatever is done, because really we don't know what happens there. Why am I saying that? I went to the council just yesterday to find out how I can open a spa. And they said, all I have to do is pay 100 and, I think I have to pay 109, 1,900, 1,600. After I've paid 1,600, I can now get a fire certificate from the fire department at the council. I pay 1,000 something for that. Then I get a health certificate from the health department of the council. So I asked them, I said, what qualifications should I bring? What papers do I need to bring here? They said, nothing. You can just pay these things that I have said, pay for the fire certificate, pay for a license from the council, and get a health certificate from the health department. So when someone has a spa, don't expect that you're going to find professionals. Anybody, according to them, can open a spa anywhere. It will be inspected later, and they can go ahead and do whatever they want to do because they are not professionals. They are not regulated. Now, I asked them who regulates these spas. They said no one regulates them. As long as you pay these things that they told me to pay, it's fine. You can open a spa. Health Professions Council does not regulate them. I'm glad to mention here that a few years ago, Health Professions Council and the Zambia Society of Physiotherapists and the spas met because Health Professions Council are regulators of anybody who's dealing with the health of an individual. And they were actually informing the spas that we're going to start regulating you, so you must have qualified people in your institutions. The spas were not very happy because they thought we were infringing on their freedoms to operate because nobody had ever told them that they needed to be regulated. But Health Professions Council was right, because when a person who's not a physiotherapist, for example, is massaging a person, sometimes you come out of those spas in pain. Why does that happen? Because they are massaging where they should not massage. For example, they will massage over bony areas. They don't know what anatomy is. They don't know where the muscles are. They don't know where pain will come from, and they massage anyway. And they put pressure in areas where they are not supposed to pressure. And sometimes they really do injure people. A person comes out worse than they went in. So right now, the spas are not regulated. They do what they want to do. And that issue with Health Professions Council did start, and we pray and hope that Zambia Society of Physiotherapy is still following that up to see how we can have professionals in every spa. The suggestion was to have a physiotherapist in every spa, because also physiotherapists are exercise specialists, because we have treated people in physiotherapy departments who are in pain, who have been injured because of the overzealousness of the trainers. So we are waiting and hope that ZSP is going to follow up this issue of physiotherapists being in spas. But right now, HPCZ has no role to play in the spas. And the council does not regulate the spas because they don't have specialists to regulate what. All they know is this is happening and it is going on. So basically, that is in the area of regulation. Nobody is regulating them, they regulate themselves. So I think with that, I would like to conclude, and then maybe we can have some questions if there are any questions or any clarifications that are needed in terms of massage regulation and the benefits of massage. Thank you.
Thank you, Mrs. Salati. Yeah, this is very thorough explanations from you and Mrs. Mwanza and Ms. Mapani and Mr. Chilufya. Yeah, we really appreciate it. So there's going to be a lot of questions because you've been talking about of course, the health benefits, the type of qualifications that physiotherapists have, the type of different ailments or conditions, as you call them, that can benefit from a physiotherapist, and then the spas that people have become to read about in the newspapers very recently. So I'm sure there'll be questions about that. And also the role of the Health Professional Council of Zambia. We all thought that, there'll be like more oversight in this area of business, but certainly it's kind of loosely regulated. So before I ask my questions, I'm going to allow my colleagues on the call to start it off. So gentlemen, please go ahead and ask a question to one of our 4 presenters. Okay, who's gonna go first? Mr.
Okay, good afternoon. I have a number of questions. Maybe before I ask the questions, I would like to just pass a comment. From what I have heard in the presentation, if the spa doesn't have qualified people to do the massage, it's possible for somebody to go into the spa and come out just having experienced some form of foul play, not the actual massage as it is supposed to be done. My first question is, are these spas graded or categorized, or every spa can give the services that we have been told here? Every spa, you can get all sorts of services, or they are in categories? That's number one. Number two, the presenters must know that they are presenting to people that are a bit advanced in age, like myself. We are now a bit old, and from the readings here and there, we are told when you do some kind of massage in holy matrimony, you get the satisfaction that comes with the massage. And especially after reading about the Pamosi experience, one would believe that indeed, if there is some massage done in a certain way, it can help you kill each other. And so, if that is true, would like to hear what kind of it, because with age, you find you only get happy once a month. And with the help of massage, I think after that once a month, you can walk away satisfied and with your hands in the pocket the rest of the other month until the next episode. Please forgive me if I have used the strong language, but I would like to learn. Thank you very much.
Mrs. Salati, do you want to address that or no? Are the spas graded?
I think Lweendo is. Are you muted?
Me?
No, Lweendo. Is it Lweendo?
Oh, Lweendo is speaking? Okay. Yeah, please go ahead.
I think she was saying something. I might be wrong, but she's muted.
Oh, yes, I'm muted. I was speaking to Mrs. Mwanza. She's saying something.
Thank you so much for that question. Massage has got a lot of benefits. And then as you get older, I think I'll take up on the second question. Ours, what we do is therapeutic massage. So that is in the essence of management. But the extra massages that can be able to help you, because what Mr. said, that we know the anatomy and we know the physiology, and we know where sensitive areas which are there in the body And you can be able if somebody is willing, but it's not like really our goal as the therapeutic part of massage, but it can be enhanced like on a consultative matter and basing it upon the anatomy and physiology that one knows and understand, and can be able to enhance in that area, but only not that somebody can be able to offer the services willingly. You can only base it up with anatomy and physiology that one knows and be able to it can be able to enhance the sexual relationship of a couple.
May I respectfully chime in?
Yeah, sure, go ahead.
Yeah. So as a person who practiced physiotherapy and also conducted therapeutic massage, I just wanted to say that when we talk about the massage that happens between couples, that is not really the purview of physiotherapists. So in terms of it enhancing the quality of the relationship, that is not the territory of physiotherapists at all. So that's why the ladies clearly explain that the lady and the gentleman, that the type of therapeutic massage that they do is pretty focused on anatomical areas that are experiencing some type of condition. Physiotherapists are not permitted at all to touch places that are sensitive at all. It's not even part of our training, as they confirm that when you touch those areas, you are pretty much conducting an illegal activity. And if you're reported, you might lose your license, because all physiotherapists in Zambia are licensed. So what couples will do, or those people who are purporting to be masseuses or massage therapists, unfortunately, it's almost like a wild, wild west out there if they're not trained. That's all I wanted to add.
Thank you, Mumba. That's a good contribution. There's a question in the chat there from Mr. Lumbama. He says, I have a condition where my leg loses power from the hip and only pains when I want to move the leg or walk, and physicians are not giving me a solution, and it comes occasionally, maybe after 2 or 3 years. It recently that they recommended massage.
Okay, may I?
Sure.
Yeah.
Okay, yes. So in that case, what he needs to do is that you need to see any physiotherapist so that we can do a thorough examination. So in that examination, we're going to do tests to see which structure or which body structures could be causing the pain. Okay, sometimes pain that comes from the hip and goes down the leg actually originates in the back. So there are different things that could cause it. So we just need to pinpoint what the specific cause is. After the specific cause has been pinpointed, then we can, then a treatment plan can be put in place. Now, the recommendation for massage, it would be helpful to relieve muscle spasm and tension. But if the diagnostic part is not addressed, we won't actually know what the real problem is. Massage would just be like putting a bandage on a wound. It won't actually work to, it won't heal, or it won't cause the problem to go away. So it's like taking a painkiller. So what he needs is a thorough assessment. Yes. So let him go to, you can go to your nearest hospital. I think there are physiotherapy departments there, or you can contact any of us to refer to someone, or we can do it ourselves. But what we need is to get a proper an assessment done. Yeah.
And then maybe just an addition, you may need to see an orthopedic surgeon who will refer you to a physiotherapist. If you are able to access an orthopedic surgeon, I'm not advertising, but Lusaka Trust Hospital has an orthopedic surgeon who comes in Monday and Tuesday, and you have orthopedic surgeons at Italian Hospital, and you have orthopedic surgeons at government hospitals like Levy and and UTH. So if you see one of those, at least they will allow you to have an X-ray so that the physiotherapist and the doctor themselves can actually see what's happening to the bones, and then actually see what is causing this problem. Because massage is not the only treatment for that condition, and we suspect there that maybe there's a condition called sciatica, as Ms. Mapani said, where the nerve is being impinged. Thank you. I wanted to respond to the first one, which talks about graded. Are these spas graded? From this form, which I got from the council, there are about 5 classes. And the second class is B, which says you pay 3,300 and you can have a massage parlor. The next one, you pay 1,500 and you can have a gym, and mostly a gym will have a massage parlor, even illegally. And then E, you can have a gym and a health shop. So when you see a gym, especially here in Zambia, you find that there's somebody who's doing massage in some corner. So they have about 4 classifications here, but no proper explanation of what should be done in those places. This form is from the council. Thank you.
Yeah, thank you so much. That's very useful information there. We have a question in the chat. One of our friends says he has a 15-year-old boy who has been wheelchair ridden or bound ever since. The boy was diagnosed with Lesch-Nyhan condition. Any advice physiotherapy-wise?
What's the diagnosis, please?
It says Lesch-Nyhan, Nyhan.
Sorry. Go ahead.
Okay. So let me look at the question. What? Any advice physiotherapy-wise? Okay. The advice might seem standard, but the advice is to come to a physiotherapy department. And the reason why I keep saying we need to do an assessment is because the treatment for 2 people have the same condition, the treatment will not be the same. Condition or disease affects them differently. For that Lesch-Nyhan syndrome, I know that there are different, a person might have different symptomatology, like there might be different things that the person might experience. For example, someone might have a gouty arthritis, others might have involuntary muscle movements, and so even the neurological impairments can be different. So we'll have to see depending on what is exactly affected. But the fact that he's wheelchair bound, okay, so this person is not walking. So we'd want to see if he has any muscle strength altogether, if there's no muscle strength at all, or if there's a little bit of muscle strength. So we have a muscle grading system where we're able to tell how much muscle strength this person has. And then after that, we can determine where to start from, okay, yes, the boy has involuntary muscle movements. Okay, I'm seeing that. Yeah. So we will know where to start from. But with the involuntary movements, we also have therapies in place where we try to rehabilitate, or can I say habilitate, and help children and even adults who have involuntary movements and conditions with involuntary movements, to help them have better control over their bodies so that they can be more independent. So if it comes through, then we can actually take a look at the specific issues. We'll tackle each of those issues one at a time. Muscle strength, we'll look at that. If it's involuntary muscle movements, we're going to look at that. If it's because this is a metabolic disease, it affects the chemical processes in the body. So there might be other things that he has that might need a physiotherapist to intervene. So, but in terms of movement, we can do that assessment, and we work with him, and we're able to track the progress week after week, month after month, and we'll see how he improves. If he's not improving, we'll change the treatment plan and see what else can be done.
Thank you so much for that response. Any more questions? Okay, yeah, they are in Kalulushi or Kitwe area. What's the most appropriate center to visit? Yeah, any recommendations over there in Kitwe, Kalulushi?
Kalulushi
I
has
think I can go to Kalulushi.
Go ahead. Go ahead.
Okay, thank you, Mrs. Salati. So you can go to Kalulushi General Hospital, but preferably also Kitwe General Hospital. And you can there's also Company Clinic in Kitwe that is on the private part. Or Busakile Mine Hospital as well. They're able to offer physiotherapy services in Kitwe. Thank you.
Thank you so much. There is a question in the chat that says, I have a friend with a restless leg syndrome. His right leg starts shaking at any time. Can a massage help?
I think just as Lweendo has said, from a conversation like this, without assessing the patient, it's very difficult to say that massage will help. Maybe it will be one of the modalities of treatment, but he would need to have further assessment, and then they come up with a treatment plan.
Okay.
Thank you.
Yeah, another.
Samson,
Yeah,
I have a
go
question.
Go ahead, Sima, go ahead.
Yeah, this is Chilima Karima, Penta 96. So for me, maybe I missed it. Probably already discussed this, but as far as how affordable are these physical therapy or accessible, and are they covered by some of the health insurance companies that are offered in Zambia? And if you are paying out of pocket, what's the average cost just to go see a physical therapist for a consultation? I know massage, I'm looking at it more like a luxury thing. You can just walk in, pay, but when it comes to physical therapy, probably that's a different ballgame there.
Most of the insurance companies in Lusaka are now accepting to pay for physiotherapy. So, and then of course, the other one is NEMA. NEMA as well accepts to pay for physiotherapy. And with NEMA, you can access NEMA in some private hospitals. The best thing is to go to the webpage, and they give you a list of hospitals that can use NEMA, because it's not only the government hospitals that are accepting NEMA now, but other insurance companies like Prudential are accepting physiotherapy. Generally, right now, to pay for a physiotherapist, in Lusaka, it can range from $350 to about $950 per session. That is the range. So you can also have physiotherapy in homes. Somebody can come to your home and do what they're supposed to do in the hospital, because we have physiotherapists now who have equipment and they move with the equipment. And depending on the condition and depending on the distance from where they're coming from, it can range from $350 to about $500. Lweendo, maybe you can add on something?
Yes. Well, when it comes to okay, so right now, NEMA covers some physiotherapy modalities, but I mean, there are things that could be rectified on the system, but they do cover some forms of exercise. They cover some forms of electrotherapy. Yeah, but I don't think massage is on that. No. But then the range which you have mentioned regarding physiotherapy services, that is just about right. That is accurate. It's between 350 to 950, depending on the procedure which needs to be done. Yeah, but I think Hydan can add on to that.
Okay, thank you. So the prices also follow the things that's supposed to be done, like for what's on the market for neurological conditions or rehabilitation is what Madam Lweendo said. It's 350 to somewhere 900 because there's a lot involved. But for conditions that deals with pain from maybe soft tissue injuries and also some ortho conditions, those are a bit better priced, maybe 250 to 500, like Madam Salati said. So that's what actually on the market. So it depends also on the just what is involved in the treatment.
And also, you may, when you go to a hospital, you won't find a condition that they, I mean, you won't find a modality where they just say, we do massage. You find that if somebody has a pathology, which means if somebody has a condition, you find that within the treatment that's being given to that person, massage is incorporated. In the spas, that's where you can actually say, I've come for a back massage and I've come for a what massage. But usually in medical institutions, it's kind of incorporated. That's why we say as physiotherapists, we do therapeutic, we're using it for treatment. Thank you.
So there's going to be a question here from Mr. Kambomba very soon. But then what I'm noticing here is that this is probably, physiotherapy is probably like a Lusaka, Copperbelt, Livingstone type thing. How accessible, just to add to Chilima's question, how accessible are physiotherapy services, say in Kaputa and Tsesheke and Lundazi and places like that? Because people do have injuries there also.
Physiotherapy has gone up to the level of the clinical in health care centers in Zambia. So you're able to access it at every level. So regardless of where someone is, you always have a physiotherapist nearest. The Ministry of Health has really done a great job when it comes to that. So our people on the outskirts of Lusaka are able to access those services.
Oh, that's fantastic. Mr. Kambomba, you had the question.
Yes, thank you very much. I believe the physiotherapy offered to somebody because of a problem or a health issue, the frequency may be determined by the gravity of the condition and according to what the doctor prescribes. But my interest is in a full body massage. If I do a full body massage like in February, when would I need the next one? I'm asking because you are the people that understand our bodies. After I have been relaxed today, when again would I be in need of another relaxation for me to stay healthy? Thank you.
So let me respond to this one. So for the time that you need to come back for another session will also be determined by what is causing the stress. So as I said, when we're doing an assessment before we start the massage, we'll ask questions that will give us a clear picture of where the stress is coming from. For instance, you have just come for a relaxation massage, we might need to find out what is causing the stress. So if the cause is having a lot of impact in terms of your mental health and also your physical health, you might recommend that you have massage sessions probably twice a month, just to see how the massage is also responding to. So it depends with what is causing the stress levels to go high. That is one of the factors that we also look at. And also sometimes we'll look if there are any other conditions involved, like if just not stress, maybe there is pain involved, what is causing the pain. So we do a thorough assessment to just see what is causing anything that is indicating you to come for the massage session.
Okay. Thank you so much, Mr. Chilufya. Are there any other questions from the gentleman? Okay.
I don't know
Yeah.
how to raise a hand. This is Danny here.
Yeah, go ahead, Prof. Go ahead.
I just want to, as I'm in a health profession as well, but in an animal field. But I just want to hear from you you guys in the human health field. How deep can your force using your hands go into the deeper tissues? Like how deep is the so-called deep massage? Because, for example, if you have a very big gentleman with thick muscles, back muscles, for example, those weightlifters and stuff, is it possible to do a deep massage in such type of body? I'm saying this because in our field, I'm a veterinarian here in Canada. There's a field coming up now as animal massage therapists, and I'm one of those people fighting that because there's no way you can massage a horse back with the lumbar muscles, which are maybe 30 centimeters, 60 centimeters thick. So I just want to get your opinion as to how deep can your hands really exert pressure in these soft tissues. Are there people that you say, you know what, your muscles are too thick for me to do a deep massage, or what? I just want to get your idea, because we are fighting in our field of veterinary medicine right now with these people that are claiming that their fingers can do a massage of a horse's back, which I don't agree with. Thank you.
Oh, sorry. Let me try to also answer that one. So we use our hands quite okay to go as deep as we can, but we also use techniques where we use our pointy elbows if the muscles are too bulky, so that the pressure can be felt. We can also use nicely curved up fists to reach the patient's tissues. Then there's also a technique where we use pointy parts of our heels to also reach the deeper tissues of the muscles. And also for animal massage, we have had I've had an experience or exposure to what is known as chiropractic, where they do manipulations of the spine, manipulations of the bones for animals, and also massage, but also depends with how thin the tissue on that animal is and how thick the tissue is. So the pressure will come with the quality and the quantity, I mean how bulky the tissue is for the muscles. So for us as physios, when we're doing massage on a patient, we look at the tissues and also use techniques that will involve in pointy areas on our body that will allow us to exert the pressure, and also we maintain proper stance that will allow us to equally distribute the weight. We actually use our own weight, maintaining power of touch on the patient's tissue so that the massage can be felt.
Awesome. Thank you so much, Mr. Chilufya. So we're right on the hour mark here. I don't know if any people have any more questions, but I just had a comment here, Mrs. Salati. You mentioned something about the legal aspects of having a spa, the costs, and who's involved. Like the city council is issuing health certificates. The fire department is issuing the fire certificate. How rigorous are these services? Do they actually go back and inspect? And how often do they inspect? And basically, what happens if somebody is not in compliance with all these certifications?
I don't have an answer for that, but the way the situations are right now, Mr. Chilufya, is your facility inspected since you're running a spa? Can you make a comment on that? I doubt it very much, because if they do inspect, it must be very rare. You know, and what are they really inspecting? That you have a fire certificate in a spa in case there's a fire. Is that related to massage or anything like that? So to me, this is not enough. This is not enough. It's just that things are not in place yet. But having a massage parlor, we can call it, and what they look at, the health permits, yes, because the person they'll have to bring in their fitness certificates. They're going to do their tests. But I don't know how much inspection takes place. Maybe Mr. Chilufya can give us an idea since he's got a place that he's managing.
Okay, so we have not really received any proper inspection from Health Professional Council of Zambia, but we have had inspections from other places, like other offices, officials like the council, fire extinguisher, and also just under council, the health team that looks at how good the place is being taken care of. Because the way the spa is arranged is more of cosmetic. So you would have only cosmetic people visiting the place for that. So we still have inspections on other things, but we have not really have any proper inspection from HPCs.
Thank you, Mr. Chilufya. Somebody was asking for your contact details, Mr. Chilufya, for your spa, so they could patronize the spa at some point. So maybe you can put that in the chat so everybody can see it. Okay, so I think, yeah, we are right at the mark here where we have exhausted our time. But there was a mention about the gym earlier. So, Mrs. Salati, you know our friend Bruce that has a gym over there by Arcades.
Yes.
He has all those things in there. People go there for massages and whatnot. And I don't think the massages are run by physiotherapists anymore.
No.
Okay.
Yes, but let me bring in another comment. I hope you allow all of us to leave our phone numbers because all the physiotherapists in this group do home visits. So in case somebody needed a physiotherapist, they could get in touch with any of the physiotherapists on this platform, and they can do home visits.
That's very that's very nice comment, Mrs. Salati, because my father-in-law right now is receiving physical therapy treatment at his house.
Oh.
And yeah, we believe it helps him, you know, with mobility and just relaxation. And yeah, so thank you for that comment. So gentlemen, I think we exhausted the time. 1 hour, I think, is what we're offered by the experts here. And if there's no other comment, no other question, this is going to be like off the charts question, but you can choose to answer it or not. But somebody texted me that they couldn't make it, but they wanted to understand what tonic immobility is. Can anybody answer that or no? No? Okay.
Sorry, excuse me. I wanted to know, was it tonic mobility or tonic immobility?
Tonic immobility. They just texted me and said, can you ask what tonic immobility is?
Okay, all right. Is that in relation to the Pamela thing where she said she couldn't move
Yes,
after
yes.
having
Yes.
experienced those things? Okay, but well, the thing is, tonic immobility is not naturally attributed to human beings. It's something that we know occurs in animals where they can't move due to sort of like a sort of animal hypnosis. Like you see this sometimes in movies with in Indian snake charming and everything. you know. So, but for human beings, the only situation that I can really say human beings enter tonic immobility is in times when they have extreme fear, like they're extremely scared, you know. So they're about 3 reactions that animals make to threats. They'll either run, they can fight, or they will freeze. Okay, so it can be extremely scared of something, and it just causes them to stop and to freeze. So now I'm also wondering how, like when I read that, I was wondering how that would cause the lady to freeze. It's not a typical response to sexual stimulation, but you know, we can't exclude anything we don't know, you know. But usually it's in animals, and usually it's in cases where someone is extremely scared of something, like they just freeze and just stand there. That is how we can talk about it in human beings.
Or even if you drink too much.
Oh, I didn't drink too much. Okay, I've seen a message from Mumba, and she said that she had a history of sexual abuse. Okay, in such a case, I think it can happen. Okay, let me not say. Okay, the more common one is yes, freezing, and also vaginismus, where someone's unable to maybe penetrate or anything. But if she had a history of sexual abuse, then I think that would definitely be a possibility, because I went through a few stories of some ladies who passed through some sexual trauma of some sort, and these were people who were traumatized young, and at a certain point, when they realized that they were about to be re-traumatized by an abuser, they would have a moment of freezing. But though I don't know whether that could have been called tonic immobility, but they would freeze at that point because they knew what was going to happen, but they didn't feel they couldn't do anything about it. But as I said, I cannot, we were not there, we don't know. But if we had to add her history of abuse, maybe, yeah.
Awesome.
Well, it's, I'm just going to say just a very brief comment. It is a thing. It does happen in human beings. The problem is when things happen in privacy, it's hard to say, did it actually happen? But we're mostly just basing it on what she said and what she's reporting as having been exposed to sexual abuse. But it does happen in women who've been abused.
I see. Okay. Mrs. Salati, were you making a last comment?
No, I think my last comment would just be to thank you for inviting us so that we can come and give first-hand information on massage as massage specialists and exercise specialists, so that our colleagues can understand everything about massage instead of just hearing hearsay from what's happening in these spas. Thank you very much for inviting us.
Okay. You're most welcome. Tukwayo, I'll send the phone numbers when I send the video here in a little bit. Last question, Mrs. Salati, did any of your family members work for Barclays Bank? Somebody texted me and wanted to know.
No, they didn't. None of us. Me, I did when I finished school a long time ago for 6 months. At
Barclays Bank? Okay.
Yes, Kafue House.
Oh, Kafue House. Okay. So Chilima, one of my friends here, Chilima, his dad and my dad were Barclays Bank people.
Okay.
Yeah, my dad worked at North End branch. Chilima's dad worked at Kafue House in head office, and Mutava House. He was the big honcho there at Mutava House for a long time. Okay.
Okay.
Yeah. So, anyways, so thank you to our panelists. That includes Mrs. Vuniwe Mwanza, from a lecturer at Apex Medical University in Lusaka. Ms. Lweendo Mapani, also a lecturer at Apex Medical University in Lusaka, and Mr. Hydan Chilufya, who's a lecturer at Evelyn Horn College, where my wife actually went some time back, not too long ago.
Long ago.
And then, of course, Mrs. Salati, who's a consummate physiotherapist and has treated one of our friends, Tambala Miyawala. He couldn't make it today, but he said I should say hello to you, and you helped him a lot.
You.
Absolutely.
Thank you.
Yeah. So this is a very helpful discussion, and like I said at the onset, our alumni group is very active in seeking knowledge about different things for the purpose of just improving our lives. So I'm going to share your phone numbers with my colleagues here, so that if they have anybody that needs services, mobile services to go to their home, they can actually reach out to you. But from the bottom of my heart, and also on behalf of St. Paul Secondary School in Kabwe, I'd like to express our gratitude, and hopefully we can meet again. And if you have somebody wanted a demonstration to see how you do a demonstration, hopefully we can make that happen in the future. But yeah, so thank you so much. It's Friday in Jakarta, so go have a glass of wine.
Thank you so much.
Absolutely. Thank you so much. Okay, meetings adjourned,
so
gentlemen.
much.
Yeah, absolutely. You're welcome.
Thank you, ladies.